When we think about integrated safety planning around both the violence that people may be experiencing and the substance use, and then how those two kind of interact and connect, what's helpful for advocates to keep in mind and to ask about as they're supporting somebody with that integrated safety planning?
Yeah, so it's important just to include it in the conversation, right? If that's something a survivor has shared with you, or just universal education, right? That's a huge thing that our medical advocate is really working with our programs on doing. So asking, do you have any substance use concerns? And if they say no, then okay, you move on. But that may be a chance for a survivor to maybe think like, oh, I didn't even think of that. Or this may be the chance for me to share with them because they want to know. So, first and foremost, including it in the conversation and safety planning, because so often when we safety plan, we're so focused on what happens if you see your abuser, right? Or what happens if you get a call from someone in, this identified unsafe network that's related to your abuser. But we need to understand the dynamics of like substance use coercion and to include this idea in safety planning for folks. Because even in like counseling and hotline, because not everyone comes to shelter either. So it can't just be a shelter-based conversation or a shelter-based kind of idea. It should be incorporated universally. And, start thinking about, if you go to work, what happens if your coworker asks if you want to use after work? What can we do to keep you safe? Right. So these are things that are kind of outside the box of thinking when we think safety planning. So we're thinking immediate physical safety, from getting from A to B or getting through the day, but really expanding it into emotional safety as well and physical safety on what do you do if you feel like you want to use or you're walking past the alleyway where you used to meet up with your link or, something like that. And incorporating that in, it's really important to really think about the life of the survivor and what it looks like truly on a daily basis to incorporate all these elements actively, especially when we're talking about folks with substance use or that are engaging or in recovery. And then also, sorry, if survivors are going to a recovery center, a facility, how advocates can safety plan with folks there, right? Because again, it's not always about physical safety, emotional safety, safety around identity, around expression, how they can express their, gender identity, express their true selves in a safe way in those places, including places that utilize like legal or government names only, right? So getting dead named regularly and how to plan for that. Having those conversations and supporting that, that's part of safety planning because it's keeping them emotionally safe to move forward. It's also important for like overdose prevention, right? To be trained on Narcan and be explicit about that with survivors, right? Like we are trained, we are educated. There is no judgment if that happens, right? Like you are not going to get evicted if this happens, right? You won't be discharged from services. This is just a reality. We are here to support you. And sometimes it may look like that. And that's the reality of what it is. And really to make that a part of the process for getting to know someone. Just kind of laying that all out there of whatever support you need, we're here to do. And then making sure anything that gets shared, you integrate into a holistic safety plan.
Yes. And that there's so many potential areas of risk, both to our physical well-being, our emotional well-being, our spiritual well-being that get missed if we aren't able to kind of weave in some of that just attention to the substance use.
Absolutely. Yeah. And, we aren't medication managers. But oftentimes folks come in, they have a lockbox. That's a conversation you have as well. Anything you keep in there, we don't look at, right? This is your safe space. And it starts building that trust, shows that you do understand that you're not just another figurehead of a system saying, we support you, we believe you. And then there's all these like punitive repercussions. If you come home and you're, I can smell alcohol on your breath, now you're evicted. That's not how this works. It's about integrating that in, having real conversation and incorporating that into their safety plan, because that's showing them this is a piece of you. I want to help keep you safe. This is a big piece of that gets overlooked. So let's talk about it, right? So it's really important.
Yeah. Yes. And lock boxes are so incredibly important. And I sometimes get the question, we have lock boxes and still, people haven't kept a substance or haven't kept something in their lockbox that should have been because the lockbox is maybe in a different part of the building and they left something on their bed, right? So what can that conversation look like? Or what can the how can an advocate maybe follow up if that happens?
Well, so if you come across a substance like out in the open, because we should never be opening survivor lockboxes, searching survivor rooms for no reason, especially without consent. But really, it's a conversation, right? Of, hey, I found this, I was walking past your room, the door was open, I looked over, there was, a needle on the floor. Let's have a conversation. Doing it in private, not in front of everyone, is really important because we're not going to shame folks and add to the stigma and shame of being active in substance use. Really just saying like, hey, like we give you lock boxes, like, well, technically, if we see it out in the open, it has to be disposed of by federal law. So that's a conversation. But just like, hey, we give you this lockbox. Is there something going on that's not having you keep that in there? Is there a reason you don't want to keep this in your lockbox? Is there something different we can do to keep your stuff safe? Because when we see it, we have to dispose of it. No one's in trouble, no one's in trouble, making sure that it's not like a look what we found kind of conversation, but just really seeing what the issue is of like, why isn't this in your lockbox? Are you having issues accessing your lockbox? Is it not in a good location for you? How can we change that? What can we do differently? How can I help you to be able to keep your item safe, right? Not only you, but whenever things get left out, there's other folks in shelter, making that community element come into play, because that's also important. But really just asking what their need is around that. And having them say, it's an honest conversation. Tell me what you need. Do we need to give you a separate lockbox that you keep in your room? We can do that. And really just supporting what it is they need. Sometimes it's just, oh, I forgot, I didn't make it. That's okay. So how about next time we make sure maybe we can do like a checklist before we get out the door, phone keys, wallet, lockbox, making sure everything's locked away. Just coming up with small strategies that can help them feel supported without, again, a punitive piece attached.
Yes. And I can feel, as you describe it, I can feel the lack of judgment and the lack of stigma and how that really invites open conversation and engagement. Like if this were something that I were dealing with, I would feel really safe talking with you about it.
Yeah. Well, thank you. Yeah, that's what we try to encourage, because again, we're not here to judge. That's not why we're here. We're here to provide as safe and secure place as we possibly can for whatever that looks like for the survivor. So it's important that the only way we can do that is to work, to talk with them, right? That's the voice we need to be guided by. So, if something isn't working for them and we're seeing that, a punitive measure isn't going to help anyone involved. It's about conversation and moving forward together.
Yes. Oof. I wish we could just like take that and like just like put it in like streamers across the sky for everyone to take in.
I want it on a t-shirt.
Yes.